What is going on, everybody? It's Medicosis Perfectionalis, where medicine makes perfect sense. This video is brought to you by Picmonic. It's a continuation of my microbiology series with Picmonic. Today's video is part 17, in which we'll talk about many fungi such as Candida albicans, Aspergillus fumigatus, and Cryptococcus neoformans. What is a fungus? What's the difference between a monomorphic and a dimorphic fungus? And what's the distinction between superficial mycoses and systemic mycoses? Let's find out. Click the like button, click the subscribe button, and let's get started. You can try Picmonic for free today by clicking on the link in the description. You can find this series of videos organized in two playlists. The first one is called Microbiology, and the second one is called Picmonic. In part 1 in this series, we talked about actinomyces, listeria, corynebacterium, diphtheria, and nocardia. In part 2, we discussed the Clostridia. Part 3 took care of Staph aureus, Staph epidermidis, Staph saprophyticus, and Streptococcus pneumoniae. Part 4 was about the rest of the streptococci, such as Viridans group, Strep pyogenes, Strep agalactiae, Enterococci, and Strep bovis, currently known as Streptococcus galolyticus. In part 5, we covered Bacillus anthracis, Bacillus cereus, Mycobacterium tuberculosis, and Mycobacterium leprae. In part 6, I taught you about Neisseria meningitidis, Neisseria gonorrhea, and Moraxilla catarrhalis. Part 7 dealt with Haemophilus influenzae, not to be confused with the influenza virus, because Haemophilus influenzae is a bacterium, but influenza virus is a virus. Bordetella pertussis, which causes whooping cough, Pasteurella, Brucella, and Francisella. In part 8, we talked about Legionella and H. pylori, which is a cancer-causing bacterium. In part 9, we conquered Campylobacter jejuni, Vibrio cholera, E. coli, and Klebsiella. Part 10 was on Pseudomonas, Proteus, and Salmonella. In part 11, we discussed Shigella and Yersinia. Part 12 was about the spirochetes, Treponema pallidum, which causes syphilis, Leptospira, which causes leptospirosis, and Borrelia burgdorferi, which causes Lyme disease. In part 13, we talked about Chlamydia, Rickettsia, Mycoplasma, and in part 14, we talked about the torch infections. This is an acronym. Do you know what this acronym stands for? Comment below if you know. Part 15 was about Anaplasma, Bartonella, Coxiella, Ehrlichia, and Rickettsia. Here is a tip for the pros. As long as you are a student, not a PhD microbiologist, here is a very important trick. If the name of the bacterium ends in Ella, you can take it to the bank. That is going to be gram-negative and not gram-positive. Again, this is only for students, not for professionals. And in the last video, we talked about histoplasma, blastomyces, coccidioides, and paracoccidioides, which cause histoplasmosis, blastomycosis, coccidioidemycosis, and paracoccidioidemycosis diseases, respectively. Today, we'll talk about Candida albicans, Aspergillus fumigatus, and Cryptococcus neoformans. This video belongs to the science of microbiology. What does ology mean? It means the study of. Study of what? Bio, which means life. What kind of bio? The small ones. The microscopic ones, the small life. We divide microbes into bacteria, fungi, viruses, and parasites, but beware because many parasites are macroscopic rather than microscopic, and hence the science of microbiology is divided into bacteriology, fungology or mycology, virology, and parasitology. Today we're talking about mycology. The prefix myco means fungus. How about a fungus disease or a fungus condition? We call this mycosis. Myco means fungus, osis means condition. Do you remember how we classify the bacteria? We classify the bacteria into gram-positive bacteria and gram-negative bacteria based on the gram stain. The purple ones are the gram-positives, the pink ones are the gram-negatives. The gram-positives could be cocci, spherical, or rods, elongated. Similarly, the gram-negative could be cocci or rods. If the bacteria is a gram-positive coccus, what's the next step? The next step is to ask yourself whether it's catalase positive or catalase negative. If it's catalase positive, it's a Staphylococcus. But if it's catalase negative, it's Streptococcus. What if it's a gram-positive rod? The next question is it a spore-forming or not? If it's not a spore-forming, the next question is it aerobic or not? And these bacteria were discussed in video 1. How about if it's spore-forming? What's the next question? Same question. Is it aerobic or not? The disease-causing Clostridia are all anaerobic, and they are all gram-positive bacilli, and they do form spores. spores indeed. And these ones were mentioned in video number 2. If we have a gram-positive coccus and it's catalase positive, it's Staphylococcus, see video number 3. If it's catalase negative, it's a Streptococcus, see video number 4. If the bacterium does not stain well with gram, but instead is acid-fast, that could be Mycobacterium leprae or Mycobacterium tuberculosis, see video number 5. And that's it for the gram-positives. How about the gram-negatives? They could be cocci or rods. If it's a coccus, could be a Diplococcus or a Coccobacillus, meaning part spherical, part elongated, or kind of in between. If it's a gram-negative rod, it could be a bacillus or a curved rod. Next, how do you know whether a bacterium is lactose fermenter or not? We use the McConkey agar. If it's a lactose fermenter, it will give us pink colonies. If it's not, we'll see white colonies. The gram-negative diplococci could be maltose fermenters or non-maltose fermenters. The maltose fermenters include Neisseria meningitidis, and the maltose non-fermenters include Neisseria gonorrhea and Moraxilla catarrhalis. See video number 6. The coccobacilli are mentioned here. See video number 7. The gram-negative rod that is curved is H. pylori. The one that's not curved is Legionella. See video number 8. Another curved gram-negative rod is Vibrio cholera. Another is Campylobacter jejuni. Non-curved gram-negative rods include E. coli and Klebsiella. And this was video number 9. Video number 10 talked about Pseudomonas, Proteus, and Salmonella. 11 discussed Shigella and Yersinia. For the spirochetes, we do not use gram stain. Instead, we use the dark field microscope. These ones were supposed to be gram-negative, but when we use gram stain in real life, they did not turn to stain well with gram stain, neither purple nor pink, so we call them atypicals. In part 15, we talked about many gram-negative organisms. If you want some charts to help you classify these bacteria, Picmonic has such a chart. Use the link in the description box. And in the last video, we talked about these 4. These are systemic mycoses. They cause systemic symptoms all over the body, not just in one specific area or organ. Today we're talking about Candida albicans, Aspergillus fumigatus, and Cryptococcus neoformans. And these are fungi, of course. Are these superficial mycoses or systemic mycoses? Well, it depends. Candida, for example, could be superficial or systemic. The oral thrush is superficial. The diaper rash is superficial. But candidemia is systemic. Usually superficial mycoses are mild, but systemic mycoses are severe. If the fungal infection is superficial, we usually treat it with a topical agent or an oral medication. But if it's systemic, we need oral or parenteral. The word parenteral means injection, could be intravenous or intramuscular. Another classification for fungi is whether they are monomorphic or dimorphic. Morphic from morphology, which means shape. Mono means one. So this is one shape. This means 2 different shapes. What do we mean by 2 different shapes? It means mold in the cold and yeast in the beast. What does that mean? It means that when the temperature is low, the fungus will be shaped like a mold, meaning hyphae or pseudohyphae. But when the temperature is high, beast, the fungus looks like a yeast. What did we talk about in the last video? The systemic mycoses. We had blastomycosis on the East Coast, histoplasmosis in Ohio, coccidioidomycosis in California and Arizona, and paracoccidioidomycosis in Latin America. The histoplasma, the blastomyces, the coccidioides, and the paracoccidioides are dimorphic fungi, meaning they are mold in the cold and yeast in the beast. Today we're talking about Candida albicans. It too is dimorphic, but instead of forming hyphae, it forms pseudohyphae. What's the difference? There are many differences between hyphae and pseudohyphae. One of them is the fact that hyphae have clearly defined and demarcated septa, which is the plural of septum, or cross walls. But the pseudohyphae do not have those clear demarcations. They just have constrictions, not fully developed septa. And for the pros, Candida usually makes pseudohyphae for tissue invasion, but in rare cases where Candida is systemic, causing an invasive fungal infection, we can actually see true hyphae with Candida.
Candida albicans, portrayed by the Canadian owl can, is a fungus, shown by the fungi, that causes opportunistic infections in humans. Growth patterns in culture differ based on ambient temperature. When cultured at 20 degrees Celsius, it grows as yeast and can shift to pseudohyphal growth, portrayed by the sumo growing hyphae from the pot labeled 20 degrees. At 37 degrees, however, the fungus demonstrates germ tube formation, illustrated by the germinating tube at 37 degrees Celsius. This organism is a normal constituent of oral, gut, and vaginal floral, but can overgrow and cause infections, especially in immunocompromised hosts. One common type of candidal infection is pruritic vaginitis, shown by the prairie dog and vagina violet, commonly called a yeast infection. A characteristic white cottage cheese-like discharge will be seen, shown by the cottage cheese. On exam, the vaginal mucosa has a fiery red appearance, shown by the fiery flower petals. There are multiple risk factors for candidal infection. Diabetes is one example, shown by the dyed bead pancreas. Patients taking antibiotics are also at risk, since this disrupts normal bacterial flora, shown by the ABX guy. In immunocompromised states like AIDS, esophageal thrush can be seen, represented by sarcophagus trash with the band aids. In infants, Candida overgrowth can cause a diaper rash, shown by the diaper with a rash being examined by the dermatologist. Lastly, this fungus can cause endocarditis, especially in IV drug users, portrayed by the donut heart card with IV drug use. So, in summary, Candida albicans is a fungus that causes opportunistic infections in humans. When cultured at 20 degrees Celsius, it grows as yeast and can shift to pseudohyphal growth, but at 37 degrees, it demonstrates germ tube formation. Candida can cause a pruritic vaginitis, which presents with a white cottage cheese-like discharge and fiery red vaginal mucosa. Risk factors for infection include diabetes and antibiotic use. In immunocompromised states, esophageal thrush can be seen. Other presentations include candidal diaper rash in infants and endocarditis in IV drug users.
Remember that it's the function of the T lymphocytes to normally protect you against viruses and fungi. But what if I have a T cell disorder? Then I can develop fungal infections and viral infections.
Chronic mucocutaneous candidiasis is shown by the old crone wearing a mucus skin suit with a Canadian flag. This is an immune disorder characterized by T cell dysfunction, the deflated tennis balls. This causes the patient to be susceptible to chronic infections by Candida albicans, shown by the Candida owl can. Like the name suggests, individuals are susceptible to infections of the skin, illustrated with the skin suit, and of the mucous membranes, portrayed here as the mucus dripping. In addition to Candida albicans, individuals are also more susceptible to human papillomavirus infections, including Condyloma acuminatum, shown by the cucumber with a condom on it.
Next, we'll talk about Aspergillus.
Remember Aspergillus fumigatus by the rip-roaring fart parties the asparagus fumigators like to throw in lungs, of all places. This fungi, or fungi, can cause several diseases in humans. Unlike many of the other systemic fungi, Aspergillus is monomorphic, illustrated by the monomorphic man, and can be identified by septate hyphae, the scepter, that branches at acute angles. The branches at an acute angle. The fruiting tree represents the fruiting bodies made by this organism, which are conidial heads that produce spores. The most common forms of disease are allergic bronchopulmonary, pulmonary, and invasive aspergillosis. Allergic bronchopulmonary aspergillosis, or ABPA, depicted by the allergy alligator with asparagus, is caused by a hypersensitivity to the spores of Aspergillus molds. It is characterized by eosinophilia, shown by the eosinophilia eagle, and elevated levels of IgE, the IgE electric goblin, both representing the body's allergic response. Treatment involves oral glucocorticoids with or without itraconazole, the glucorder on steroids. The next form of disease is pulmonary aspergillosis, the asparagus squeezing into lungs, where an active infection occurs in the lungs. It often occurs in patients who previously had tuberculosis and were left with a TB cavity in their lungs, shown by the TB-TV cavity. Aspergillus can then establish itself and grow into a fungal ball called a lung aspergilloma, represented by the asparagus gnome in the lungs. Hemoptysis, the red mop coughing up blood, is a common sign of this disease. Invasive aspergillosis, portrayed by the invading asparagus, is a third type of infection where the organism spreads throughout the body. It is typically seen in individuals with AIDS or those who are otherwise immunocompromised, represented by the band-aids. Individuals with chronic granulomatous disease, the Crohn granuloma, are also at risk. In invasive aspergillosis, the fungus invades blood vessels and can cause hemorrhagic infarctions within affected organs, depicted by the hemorrhage hammer and infarction fart. In the lungs, necrotizing bronchopneumonia can be seen, shown by the necrosis crow with broccoli pneumona. Treatment involves voriconazole with or without caspofungin, shown as the volcano easel and Casper fungi. Other treatment options include IV amphotericin B and isovuconazole. So, in summary, Aspergillus fumigatus is a fungi that is monomorphic with septate hyphae that branch at acute angles and have fruiting bodies. The most common forms of disease include ABPA, pulmonary, and invasive aspergillosis. ABPA is characterized by eosinophilia and elevated IgE. Treatment is with glucocorticoids and itraconazole. In pulmonary aspergillosis, spores create a fungal ball in a TB cavity from a prior TB infection and form a lung aspergilloma causing hemoptysis. Invasive aspergillosis occurs in patients with AIDS, immunosuppression, or chronic granulomatous disease. This form is characterized by hemorrhagic infarctions and necrotizing bronchopneumonia. Voriconazole is the main treatment, but caspofungin may also be used.
And Cryptococcus. By the way, do you know why we call it Cryptococcus? Crypt means hidden. Coccus means spherical, because the fungus is hidden within a capsule.
Cryptococcus neoformans, illustrated in this Picmonic as the crippled cock, is an opportunistic pathogen, which causes cryptococcosis disease. Cryptococcus neoformans exist in one form, as a yeast, at all temperatures, making it a monomorphic fungus, depicted as the monomorphic man. It is an encapsulated organism, shown as the capsule, and contains a polysaccharide capsule, the polysac capsule, which helps this organism to evade phagocytosis. Cryptococcus is urease positive, meaning it contains the enzyme urease, which causes urea to split to release ammonia. When viewed on microscopy, it can be seen to have narrow-based buds, depicted as the narrow-based bud wheels, and inoculation samples can be grown on Sabourose dextrose agar, blood agar, or birdseed agar. Another way to diagnose Cryptococcus neoformans is via the latex agglutination test, the latex feathers, which detects cryptococcal polysaccharide. Exposure to pigeons, shown literally as pigeons or pigeon droppings, is considered a risk factor for developing cryptococcosis. On microscopy, India ink stain, illustrated as the India-shaped ink stain, can also be used for easy visualization of this organism's capsule from cerebrospinal fluid samples. Moreover, tissue samples can be examined with mucicarmine staining, the mucus car, to help diagnose this organism. This illness is an AIDS-defining opportunistic infection, as it is often seen in those with AIDS or those who are immunocompromised, represented by the band AIDS. Now, those who fall ill from cryptococcosis can develop meningoencephalitis, or meningitis, the menintites, which may lead to soap bubble lesions in the brain, depicted as the soap bubbles. Another manifestation of cryptococcosis is pneumonia, shown as pneumona. Fluconazole, the flute a-hole, is a commonly used medication in infections, which can also be used as prophylaxis in high-risk immunocompromised patients. Flucytosine, the flute side toe, works to inhibit DNA synthesis and is used in combination with amphotericin in disseminated disease, illustrated as the amphibian terminator. So let's quickly summarize the key facts about Cryptococcus neoformans. This is a monomorphic fungal organism, which is encapsulated by a polysaccharide capsule. It grows with narrow-based buds and can be diagnosed via latex agglutination test. A common reservoir for this organism is pigeon droppings. Diagnosis can also be made via staining with India ink and mucicarmine. Typically, those infected with cryptococcosis have AIDS or are heavily immunocompromised, and patients can develop meningitis with soap bubble lesions in the brain or pneumonia. Cryptococcus neoformans is treated with fluconazole, and this medication can also be used for prophylaxis. Disseminated disease is usually treated with flucytosine and amphotericin.
And when you go to Picmonic.com, they give you a quiz after each Picmonic. Can you please answer these 3 questions? Let me know in the comments. You can browse the Picmonics by your favorite book. You can browse them by subject and by system. Picmonic prepares a quiz for you every single day so that you can practice your skills. And this is the methodology that I personally use in order to study these Picmonics. I watch the animation. This is called the educational mode on Picmonic. Then I watch the story animation or the story mode. I watch the animation again. I pause and stare at the picture. I close my eyes and imagine each subject or each cartoon character put in place. Then I open my eyes and evaluate. I solve the quiz. I get a blank piece of paper and write down the place of the characters using memory only, no cheating. Then I revisit the same Picmonic on day 2, day 5, and day 30. And if you do this, you will remember the Picmonic for years to come. I still remember many Picmonics that I studied more than 10 years ago. You can try Picmonic for free. You can use Picmonic on the web or on a mobile app. What I love about Picmonic is that it helps you memorize by using different methodologies, visuals, audio, storytelling. You can read a script, spaced repetition, quiz, and you can even create your own Picmonic. There are many students who created their own Picmonics, and you can find those at picmonic.com. Now let's review the important points about Candida albicans, Aspergillus fumigatus, and Cryptococcus neoformans. Remember, anytime you see a pigeon, you should think of Cryptococcus. Pigeon, Cryptococcus, pigeon, Cryptococcus, pigeon, Cryptococcus, until you condition yourself like Pavlov's dog. Here's a question for you. Why did Ivan Pavlov have such good hair? And the answer is conditioning. As we do towards the end of each Picmonic microbiology video, we compare among the 3 organisms. So we have Candida albicans, Aspergillus fumigatus, and Cryptococcus neoformans. All of them are fungi. Candida is dimorphic, meaning it's mold in the cold and yeast in the beast, pseudohyphae at cold temperatures, germ tube formation at hot or warm temperatures. Aspergillus is monomorphic, and we have branching septate hyphae. And if they are septate hyphae, you can bet the rent money that these are true hyphae, not pseudo-hyphae. And they branch at acute angles, so here's a mnemonic for you. Aspergillus, acute. Cryptococcus, monomorphic. Diseases caused by Candida include thrush. The thrush could be oral thrush, esophageal thrush, diaper rash, and vaginal candidiasis, also known as vaginal yeast infection. Because remember, Candida is yeast in the beast. And the temperature in the vaginal canal is very close to the core body temperature. Candida can lead to candidemia and infective endocarditis, as well as mucocutaneous candidiasis. As for Aspergillus, it can cause aspergilloma, which is a fungus ball in the lungs, allergic bronchopulmonary aspergillosis. I've talked about these in my pulmonology playlist, and the aflatoxins made by Aspergillus can lead to hepatocellular carcinoma. This is common among farmers in warm climates, such as among the Sudanese farmers. Cryptococcus neoformans can lead to cryptococcal meningitis, especially in immunocompromised persons. It can lead to pneumonia and encephalitis. Encephalitis is inflammation of the brain tissue itself. Meningitis is inflammation of the meninges that surround the brain and the spinal cord. How do we treat Candida? If it's oral thrush, nystatin swish and swallow. For diaper or vaginal, we can use fluconazole. For the invasive candidemia and infective endocarditis, we give amphotericin B. Aspergillus is treated by voriconazole and the echinocandins, such as any medication that ends in fungin, such as micafungin. Cryptococcus is treated with amphotericin B and flucytosine, because flucytosine will fly to your brain. Let's review the Picmonics. This is Candida, which is a fungus. It is mold in the cold, pseudohyphae at cold temperatures, and yeast in the beast, germ tube formation at warm temperatures. Diseases caused by Candida include pruritic vaginitis with fiery red mucosa. A white cottage cheese discharge is characteristic. Patients with diabetes are vulnerable, as well as patients who use antibiotics for a long time. Anyone can get oral thrush from Candida, but for Candida to cause esophageal thrush, the immune system is usually going to be weaker or immunocompromised persons. Candida can lead to diaper rash and infective endocarditis in IV drug users. Next, let's review chronic mucocutaneous candidiasis. So it's chronic and it affects the skin and the mucous membrane. This happens if my T lymphocytes are dysfunctional, because it's the normal function of the T lymphocyte to fight fungal infections. So if my T lymphocytes are weak, therefore I cannot fight fungal infections. The organism, of course, is Candida albicans. The word alba means white because the discharge looks white. Expect infection of the skin and the mucous membrane. And if my T lymphocytes are weak, I can get fungal infections and viral infections, such as with human papillomavirus, which causes condyloma acuminatum, not to be confused with condyloma lata. What's the name of the organism that causes condyloma lata? If you know the answer, comment below. Coming up next is Aspergillus fumigatus. It's a fungus. It is monomorphic. It has septate hyphae, i.e. true hyphae, branching at acute angles, less than 90 degrees, characterized by fruiting bodies. Diseases include allergic bronchopulmonary aspergillosis. This disease is characterized by eosinophilia and increased immunoglobulin A, and is treated with glucocorticoids and or azoles. Another disease is pulmonary aspergillosis. The aspergilloma usually forms on top of an old tuberculosis in the apex of the lung, because as you know, tuberculosis is aerobic. That's why it prefers the apex of the lung rather than the base. Aspergillomas in the lung can lead to hemoptysis or coughing up blood. Invasive aspergillosis is more common in immunocompromised persons. And finally, Cryptococcus neoformans is a fungus that is monomorphic and encapsulated. You can see the capsule using India ink. It has a narrow-based bud, in contrast with blastomyces, which had broad-based budding yeasts. So the broad-based bud is blasto, broad-based bud, blasto, but narrow-based bud is Cryptococcus. Also pigeon, Cryptococcus. Exposure to pigeon poop can give you Cryptococcus, and if you're immunocompromised, can give you cryptococcal meningitis. In cryptococcal meningitis, we can see soap bubbles in the brain. It can also cause encephalitis and pneumonia. And to treat Cryptococcus, you need your medication to fly to the brain. So you're gonna give fluconazole, flucytosine, and amphotericin B. If you use the link in the description, you can try Picmonic for free. And if you subscribe, you get access to more than 1,800 different Picmonics, which cover bacteria, fungi, viruses, parasites, and it's not just for microbiology. There are Picmonics for anatomy, physiology, biochemistry, pathology, psychology, internal medicine, surgery. And my absolute favorite topics are micropharmacology, genetics, and OBGYN. I think that these Picmonics are beautifully done. Whether you want to be a doctor, a nurse, a PA, a nurse practitioner, a pharmacist, PT, OT, or a paramedic, Picmonic has a solution for you. And if you use my link in the description, you get a special discount. Currently, the discount is 20%. Don't forget to download the Picmonic app on your phone, and the link is picmonic.com/VIP hookup/medicosis. Thank you for watching. Thank you, Picmonic, for sponsoring this video. As always, be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense. We'll see you next time in part 18.